Welcome to another test from the Practice Test Geeks. In this video we are going to test CNA safety and emergency procedures. For answers and explanations, check the description below and our website for more tests. Question 1. When caring for a resident who is hemorrhaging, you should A. Stay with the resident and call for help. B. Use the principal's standard precautions. C. Apply direct pressure to the area. D. All of the above. Question 2. When a seizure occurs, what should you do? A. Leave the client and run for help. B. Place fingers in their mouth to prevent choking. C. Restrain the client to prevent injury. D. Move objects away from which may cause injury. Question 3. Mrs. Jones has been throwing up for several days, unable to eat or drink. You find her in bed. She is pale, lethargic, and her eyes are dull. She is likely suffering from A. Hypovolemic shock. B. Multiple sclerosis. C. Congestive heart failure. D. Fecal impaction. Question 4. Your home health client is diabetic. When you go to his home, you find him weak and lethargic, but able to follow commands. He is unable to tell you when he last ate or took his insulin. You should do what first? A. Call the ambulance. B. Do nothing, he's just tired. C. Check his blood sugar level. D. Notify the case manager. Question 5. A patient chokes while eating and is unable to cough or speak. The first thing the nurse aide should do is A. Tilt the victim's head back and give 2 quick breaths. B. Attempt to remove the obstruction. C. Slap the patient between the shoulder blades. D. Call for the nurse and code team. Question 6. While helping an 86-year-old male resident get ready for bed, he tells you that he is tired of living and has been saving his pain pills. What should you do? A. Ask him why he feels his life is so worthless. B. Notify the nurse and stay with the resident. C. Make him give you the pills so you can flush them. D. Go through his belongings to search for the pills. Question 7. If a home care client burns his hand, you should A. Cover burn with butter. B. Apply cool water. C. Call the ambulance. D. All of the above. Question 8. The nurse aide finds a conscious client lying on the bathroom floor. The first thing the nurse aide should do is A. Offer the client a drink of water. B. Check for signs of injury. C. Help the client into a sitting position. D. Call for help and stay with client. Question 9. What is the CNA's responsibility after calling a code blue? A. Be available for any necessary tasks. B. Assume responsibility for the code blue. C. Leave as soon as the code blue team arrives. D. Participate as a full team member. Question 10. You arrive at the client's home for care. She shows you a burn on her arm. It is blistered and client is complaining of severe pain. You should A. Call the client's daughter. B. Call the home health case manager. C. Drain the blisters and cover with gauze. D. Call the client's doctor. Question 11. An elderly resident has an advance health directive that includes a DNR, do not resuscitate, order. You enter their room and find them not breathing. What do you do? A. Start the resident on oxygen at 2 L/minute. B. Call the family to see if they agree with the DNR. C. Call for help and begin CPR. D. Close the door and notify the nurse. Question 12. A resident with an obstructed airway. A. Cannot speak. B. Is always unconscious. C. Can speak. D. Can breathe. Question 13. You walk into the dining room. The conscious resident has his hands to his throat and is making no sounds. The first thing you will do is A. Call the nurse. B. Ask, are you choking? C. Start chest compressions. D. Offer a drink of water. Question 14. While getting a bed bath, a patient suddenly has a difficult time telling you that he is feeling weak on one side. The CNA should A. Pass it on at end of the shift. B. Report this to the nurse immediately. C. Reassure him that this is normal for his age. D. Prop him up with pillows on the weak side. Question 15. The fire alarm has sounded. The nurse should first A. Make sure all the residents are out of the hallway and close all doors. B. Take the nearest fire extinguisher to the nurse's station. C. Report to the charge nurse for direction. D. Notify the fire department in case no one else has. Question 16. A resident puts on her call light to let you know that there was bright red blood in her bowel movement. What should you do? A. Ask the resident if she ate beets recently. B. Tell the resident not to flush her next bowel movement. C. Notify the nurse immediately. D. All of the above. Question 17. A patient asks for an extra pat of butter from an aide who is unfamiliar with her. The aide should A. Refuse and tell her that butter is not good for anyone. B. Offer margarine instead because it is a healthier option. C. Check the patient's diet and give the butter if allowed. D. Get her the butter to demonstrate excellent patient care. Question 18. A patient complains of pain. The CNA should A. Notify the medication nurse. B. Call the patient's doctor. C. Get the patient some pain medication. D. Tell the patient to ask for the nurse. Question 19. A patient complains of feeling short of breath and nauseated. Her face is rapidly turning red. She tells the nurse aide that she didn't know there were strawberries in the gelatin she ate. The aide should A. Tell the patient that fruit is good for you. B. Note the allergy on the chart. C. Notify the nurse immediately. D. Take away the tray. Question 20. How often should a CNA renew their CPR card? A. Every year. B. Every 2 years. C. Every 6 months. D. It never expires. Question 21. The first aid treatment for hemorrhage is to A. Put on a tourniquet. B. Run and get the nurse. C. Lower the arm below heart level. D. Apply direct pressure. Question 22. As you help a resident return to his room after lunch, he seems short of breath. He tells you that his chest hurts. You should A. Help him to bed and check back after his nap. B. Immediately notify the nurse. C. Assess the resident for a possible myocardial infarction. D. Tell him not to eat so much tomorrow. Question 23. What should you do for a person who has stopped breathing and has no heartbeat? A. Start chest compressions. B. Perform abdominal thrusts. C. Call the ambulance. D. Do mouth-to-mouth resuscitation. Question 24. While caring for a resident you hear the fire alarm ring. What should you do first? A. Ask the charge nurse what you should do. B. Leave the room and look for the fire. C. Close the resident's door and any open windows. D. Begin gathering the resident's personal items. Question 25. A nurse aide walks into a room and sees that the patient is unconscious. The first thing the aide does is to A. Hit the patient's chest. B. Shake the patient's shoulder while shouting his name. C. Tilt the patient's head back and give 2 quick breaths. D. Press the alarm to call the code team. For answers and explanations check the description below and our website for more tests.